definitely look at this later. So good evening. This is Dr. Garais. This is MED120 medical terminology. Term 5, 5NAX. That means we meet Tuesday evenings at 6 p.m. and it is now 6 p.m. And today is October 20th. What is due today are all week 1 items, and week 1 items are of course, your discussion 1, and your medical language laboratory for both chapter 1 and 2, and the quiz. So let's see what's going on. And I'll be looking at, if you don't see a grade yet, I'll be looking at that after lecture later on this evening. So if you don't see a grade or you see something that's, that there's some discrepancy, call me out on it. Give me a call so I can double check, because I'm human, and sometimes I put 100s where zeros should be, zeros where 100s, but you need to have your due diligence to make sure that weekly all your grades are properly recorded in. But like I said, I didn't record any grades yet. I'll be doing that this evening, giving everyone the chance, to get stuff done. So let's start with week 2 stuff, and week 2 is module 2. And just as a recap, we're doing cardiovascular chapter this evening. And as a recap from last week, what did we learn? We learned that all notes, all medical terminology, they're in parts. And the parts could be a prefix, it could be a root, there could be a combining vowel there somewhere, and 9 times out of 10, or 99.9% of the time, to be honest, it's usually the combining vowel is an O. The root and the combining vowel together is the combining form, and then of course you have your suffix. So let's look at that word, cardiovascular. So that's the word we're looking at today. Cardi, O, vascu, AR. Now we look at it in the parts. Let's make this bigger. Let's look at it on the parts first. Anything that's on the end is the suffix. The main idea of the word is the root. And you could see here, you'll see this a lot, not a lot, but you'll see this sometimes where there are 2 roots connected together with, of course, a combining vowel. So the root here, cardi, we already learned that root, it's heart, and vascule, which is all the tubing that you have in your body. So a cardiovascular surgeon not only deals with your heart, but also deals with the vasculature. And the vasculature are all the tubes or blood vessels. And they call them vessels because it carries blood from one place of your body to another. And the main ones, the 3 main ones that we always talk about, are the arteries, veins, and capillaries. So it's like this closed system where all the tubes going away from the heart, and they're typically oxygenated, meaning that they carry a lot of oxygen. Those are the arteries. They're colored red in your anatomy and physiology textbook. But in real life, we know that if, your insides are like 18 shades of brown, it's not red. But the arteries are colored red in the textbook. And the veins are colored blue, and the capillaries are colored like blue and red. So the veins represent blood vessels or tubing or vasculature. Let me write that. Veins typically run towards your heart, and they're typically deoxygenated, meaning to say is D is a prefix that means no or not. It doesn't have a lot of oxygen. Arteries have a ton of oxygen. And capillaries are the really thin blood vessels or vasculature that connect arteries and veins, because all of this is a closed circuit. So your blood goes round and round and round in your body, and at times it's going to be oxygenated in the arteries, and other times it's going to be veins in a vein, and then it's going to have to go through capillaries. So when you look at the word cardiovascular surgeon or cardiovascular surgery, it's surgery not only done on the heart, but also on the vasculature or the blood vessels. Doesn't that look like a beautiful all of the above question, okay, regarding meaning? So some takeaways regarding this word is you have two roots connected by combining vowel, okay? And let's look at some word part questions. So if I asked you, what's the suffix of this word cardiovascular? And you'd say, it's AR. I would ask you, what is the root that means heart? And you'll tell me, cardi. I could ask you, what is the root word in the word cardiovascular that means blood vessels, arteries, veins, and capillaries? And you would say vascular. Okay. Now, regarding meaning, ... AR means pertaining to. That means the word that we're talking about is an adjective. And cardi, of course, we already know it's a noun, it means heart. And vascule, we already have it underneath, it means blood vessels. Now, when you have AR, pertaining to, right, that means it's an adjective. You don't say, my patient had a cardiovascular. That's like saying, oh, I'm sitting on this blue. This blue what? I'm sitting on a blue chair. My patient had a cardiovascular accident. My patient had a cardiovascular procedure. So when you use the words with AR or words that have pertaining to, you know they're adjectives and they precede some sort of noun. So cardiovascular what? That's like saying, you may hear your patients say this a lot. Oh, my dad had a coronary. Coronary what? Coronary, since I mentioned the word now, airy means, is the suffix means pertaining to. Let's move this a little up. Airy is of course the suffix and it means pertaining to. So that means the word coronary is an adjective, and coron means like a crown, but it means the crown of blood vessels surrounding the heart. So corona, you know, crown, right? Airy pertaining to coron, or the crown of blood vessels around the heart. So if my patient had a coronary accident, also known as a myocardial infarction or a heart attack we talked about last week, or my patient has coronary blockage or infarction. So coronary is an adjective, so it means pertaining to. Okay. Why is it? All right. Okay. So coronary, and of course, due next week, listening exercises 1, 2, and 3, exercises 1 and 2, and remember the practice is only for practice. The things that you need to complete are these critical listening exercises and the response exercises, and that's for chapter 5. So let's look at chapter 5. I can go into my medical language laboratory, which, by the way, I totally forgot. Copy link. Because I'm on a Mac, it doesn't like Safari. I gotta do this. Okay, man. Okay. So when we go, and we can go into ebook, or you go in that category when you open up your assignments, you go where it says read, and then I go here in the table of contents to the left. I'm looking for chapter 5. Last week we did chapter 1 and 2, and this week we jumped down to 5. And then let's see what we got there. And like I stated before last week, or if I didn't state it, I'm stating it now. Your textbook is for practice. It's also used for like reference. So if you don't know a word, you can look it up, but you have the almighty Google to do that as well. Do not read textbooks from front to back. If you do that, you're just making yourself frustrated and you're just going to sleep, okay? How do you tackle textbooks? And textbooks, no matter how, they try to make it as interesting as possible. But come on, textbooks aren't interesting. You know, it's not like a good novel. It's not like a mystery novel. It's there mainly to provide information. But let's say, for example, right, I didn't give a lecture, or I'm your typical professor who kind of lectures and doesn't go through everything. And remember, the responsibility of studying and getting that information is on you, not the professor. So whether you like me or don't like me, that's not the point. The point is you have to get information in your head, and you have to do that. Because the person who wrote this textbook already has their degree, I already have mine, it's now your turn. And one way to do that is, before you go on any road trip, what do you always do? You look at the objectives. So if you look at the objectives here, the first thing that I always ask is type of medical treatment, or who are the people in your neighborhood? So who are the cardiovascular, who's the vascular surgeon, what's the cardiologist, who are these immunology people, what's this lymphatic system? So that's introduction. And then primary functions. Now, you could also use this text as well in your physiology class, because look, it has primary functions in it. And remember, we stated we're just going to touch on the diseases, but only on the major ones. Okay? And remember, your medical language laboratory will deal with defining, pronouncing, and spelling terms correctly. So who are the people in our neighborhood? First is the cardiology. Logi, study of the heart. We already know that. Cardiologist, you could see if I change the suffix, then I'm now talking about the practitioner. And it's like a pet peeve to some departments, like when they say call cardiology, but who? You have to say which cardiologist. And there's several types of cardiologists. And the cardiologist isn't always a surgeon. Okay, cardiology is a subsection of the Department of Internal Medicine. A cardiovascular surgeon is very, very different from the cardiologist. So cardiologist, think what? The internal medicine guy or gal who treats you medically. But when your medical treatment doesn't work, let's say, for example, you need a cardiac bypass, we have to go to the cardiovascular surgeon for that. Those are the heart surgeons. Another kind of surgeon is it's similar, and it's kind of like the same thing, is cardiothoracic surgery. So they concentrate on the heart, but they can also do any surgeries that are within your thoracic cage or that's within your chest. Okay, so that's one kind of question that would come out because it's part of the objectives. So on an exam, I could ask you, oh, my patient needs to be treated medically for their heart. And they're 25 years of age. Is it the cardiologist, pediatric cardiologist, heart surgeon, cardiovascular surgeon, cardiothoracic surgeon, none of the above, all the above? You could see how you could easily make questions based on the objectives. Now, we typically talk about the cardiovascular system and its vasculature, all this tubing down here. Now, all these tubing in yellow, that's a different system. That's your lymphatic system. And your lymphatic system, its function is to deal with the excess fluid or provide also immune function to your cardiovascular system and especially to your vasculature. So think of wherever there's an artery and vein, there has to be a lymphatic vessel that's associated with it. And the lymphatic vessels, one of their functions is to support the immune system. And on the lymphatic vessels, you'll see there's lymph nodes, and we're going to talk about that in a moment. So just like what I mentioned earlier, in the textbook, your body is not this color. Those of us who ever cook know that it's like 18 shades of brown and gray, which is the inside of your bodies. But we use these conventions to tell us certain things. Like if there's blue, then it's got to be venous or deoxygenated. And if it's red like this, it has to be oxygenated blood. And if it's yellow, it connotes fat. And if it's green, it connotes your immune system. But in real life, it's not colored that way. So you could see here, these have to be capillaries because they're colored both blue and red, and you see a little bit of purple. If you remember your kindergarten, blue and red make purple, right? And then green, of course, that's our lymphatic system. And the lymphatic system is part of our immune system. So This is how you could use your textbook as a dictionary of every single word that would be on your medical language laboratory for your chapter 5. So they have this section right here. So you can use your book as practice, or you could do those little practice tests and those things. But my advice is to use your textbook and this section of your textbook as a compendium of the must-know words and the high-yield words. So let's look at them and break them down, each one, starting with angiography. So the combining form for the term angiography would be angio. And remember what the combining form is. It is a root plus a combining vowel. So angiography, graphy. Now, my trick to remember procedures is if I see a Y at the end of it, I'm thinking process. And graph, what do you do when you graph something? You record it or write it down. So the process of recording what? Angio, my blood vessels or my lymph vessels. So when I do angiography, it's kind of like an X-ray to look at my blood vessels to see what's going on. Now in my blood vessels, I could have a widening or a part of it that's about to burst. The analogy being is in an aneurysm, there's a weakness of the blood vessel wall. And if you've ever seen an old, what do you call that thing? Garden hose. If you take a look at the old garden hose, a garden hose is kind of built in the same way that your blood vessels are built. It's in layers, right? And if you've ever noticed, if the outer layer of your garden hose is broken or cracked, you could see that the inner tubing would start to out pocket or start to form a bubble. That's what an aneurysm is. And a bubble on your garden hose, no big deal. You go to Target, you get yourself a new one. Well, in the human body, you have a weakness or an aneurysm, it could burst. And if it bursts in the wrong place, like in a vital place, like your brain, then you're in a lot of trouble. Or if it bursts in a very large vessel, like your aorta, which is the largest diameter artery in your body. I had a family member just last year. She had an aneurysm of her descending aorta. She was dead in less than a minute. She went to the bathroom at work. She felt like she had a little bit of a headache, and then the next thing you know, in the middle of her chest, the aneurysm just decided to burst, and then she bled out internally, and she was pretty much dead in minutes. Now, because why? The blood vessels have to be cyclic and circular. So in a typical 70-kilogram male, you start off the morning with 5 liters, you have to end out the day in 5 liters. But if I have an aneurysm and it bursts, some of that stuff is going to leak out into something called third space. That means it's not contributing to your body and the nutrients and the oxygenation to your body. So what's going to happen? You're going to go into shock. And shock isn't always shock, when you get scared. Shock is the medical term that states that your cardiovascular system can no longer pump blood to where it needs to go. And that's what shock really is. Aorta is the largest artery in your body. It exits directly out of your heart, and it's kind of big. And if I have stenosis on it, osis, abnormal, sten means narrowing or stricture. So if I had aortostenosis, blood won't get to go where it needs to go, more pressure on my heart, and it's not good. You'll get chest pain and a whole bunch of other stuff. Arteriosclerosis. The suffix is osis, right? Arterio means artery. Sclere means hardening. So I have abnormal artery hardening. And that happens when all the fat in your arteries and veins that you accumulate over a small part of your lifetime, it starts hardening up. And when it hardens up, your blood pressure will increase, and then you have a you have a risk of blockage. Arteriolitis, inflammation or infection of a small artery. So let's look at this word, arteriole. And let's look at that word as well for veins as well. So if I have an artery, that's a normal size, but an arteriole, the suffix means very small artery. Now I could have a vein, but if I have a very small vein, I would have a venule, very small vein. Okay, so if I had arteriolitis, I have inflammation or infection of a very small artery. If I have venulitis, I have inflammation or infection of a very small vein. We're also going to look at other words for vein as well. Minimize this. Arthero or an artheroma is a fatty plaque. Remember we mentioned just a second ago, arteriosclerosis. These fatty plaques, fatty degeneration is when there's damage to your cell walls of your arteries, and also, you know, you drank way too much beer, ate too many Doritos, and then you're gonna have a lot of fatty plaques, and these fatty plaques are called atheromas. If they hang out there in your blood vessels long enough, you'll have arteriosclerosis. It'll cause hypertension, and with hypertension, and then of course there's also the lovely diabetes as well that'll complicate matters. Your patient has a risk of blockage, and we talked about blockage last week. Myocardial infarction, no bueno, that's not good. Atrioventricular. Now your heart, let's look at a picture of your heart. Your heart, if you look at it here, has, and it's exaggerated here for learning purposes, you have these two small rooms up here, which is your atria. See, this is a small room. This is an exaggerated small room. But you got these big, huge rooms down here, and those are your ventricles. So you have these valves here called your AV valves, atrioventricular valves, because it is a valve, this white thing here, that's in between your atrium and your ventricle. This is another AV valve because it's in between your atrium and your ventricle. So we look at that word, atrioventricular, it means pertaining to both what? The atrium and the ventricle. So in this case, just like cardiovascular, you have two roots connected with a combining vowel. Heart, cardio, coronary, we already talked about, pertaining to the heart or pertaining to the blood vessels surrounding the heart, if you want to be specific. Now, cardiomegaly, we talked about that last week. Why? Think process of abnormal enlargement of the heart. And if you took a good look at the heart and the lungs and your thoracic cage, not a lot of room there for growth. Your heart is a muscle, so if you have hypertension, you're making your heart work way too hard, and it's going to get mega. It's going to abnormally enlarge. Your heart is the last muscle in your body you want to grow. Grow all the other muscles all day, but this is the last one you want to grow. It's not good. Vein, we already talked about venous, right? Us pertaining to vein. Now, phleb. Phleb also means vein. So instead of calling it venitis, which is, you know, it's not a real word. Phlebitis is the term for inflammation of the vein. And some of you who are already working in the biz already have training in venipuncture, right? Venipuncture. That's also known as phlebotomy. Phlebotomy. Now let's look at the word phlebotomy. Tomy is the suffix that means to cut or process of cutting. And what's phleb? Vein. And if you took a good look at your needle, they actually call it a cutting needle. And that's what we're actually doing when we take blood from you. That's why we have to disinfect the skin, because I'm actually cutting into your skin and into your vein. And veins are more superficial, and the arteries are more are deeper. Okay. Thrombo is clot. So your thrombocyte is a clotting cell. But if I might have to give some medication called a thrombolytic to perform thrombolysis. Lysis means separation or destruction of. Thromb means blood clot. So if I give something like warfarin, which is a thrombolytic, What is it doing to the excess blood clots that I have in my body? It will break them up. Varicose veins, those are dilated veins because your veins also have, what's it called? Your veins also have, what's the word I'm looking at? Valves. Ugh. I am not the master of the English language today. So let's look at varicose veins. This is a picture's worth of 1,000 words. And this looks like your grandma's leg, doesn't it? Or it might look like your leg if you stand around a lot. And veins are supposed to have valves because veins are low pressure, right? They're supposed to bring nice and gently and easy blood back to the heart. But the problem here, like if you stand around for a long time, the valves break down and then there's backflow. And if there's backflow, it gets backed up like a log jam of blood, and you'll get these things called claudications. You'll get some pain. So that's why grandma or grandpa, or whoever you know has these, has to wear those stockings, those compression stockings. Maybe it's also all the rage for runners and also people who do CrossFit. If you those of you who go to the gym, you see a lot of young people with these knee-high socks because there's some minor data out that says if you wear compression socks, it increases the blood flow back to your heart, and especially if you're working out, and also brings stabilization to your muscles so you don't pull as much. I don't know. I tried wearing compression socks when I used to be a runner. I didn't see any real improvements on my running time, and also I don't know, it made me feel more sweaty. But hey, it's science. Gotta love it. So that's varicose veins. Those are varicosities, are dilated veins, and that's abnormal. Vasospasm. Now, your your arteries and veins are surrounded by they're surrounded by muscle. Arteries are surrounded by muscle more so than the veins. That's why you have blood pressure, because when your blood pressure drops, the muscles start squeezing a little, so it helps maintain blood pressure. But every once in a while, especially when you get older, you get spasms, these random spasms of involuntary contraction or twitching of muscle. Now, if it happens to your muscle in your arm, maybe you've experienced it when you're tired, or your leg, it's no big deal. But when it happens to an artery, it could spike your blood pressure. It could cause syncope or fainting. Let me write that word down, syncope. It's a fancy word for fainting, right? Because if you have cardiovascular anomalies, right? Remember, who's bringing back the oxygen to your heart and to your lungs? It's the cardiovasculature, or it's the tubing in your body. And if they're all clogged up, or you got vasospasms that are squeezing on your arteries, you could black out for a little while. Vascular, we already went, a blood vessel, and we call them vessels. Like the word vessel is like a ship. And what do ships do? They transport things from one place to another, and that's what the tubing does. It transports blood and its blood products from one place to your body to another. Intraventricular. Intra is your prefix, that means within. So if my patient has an intraventricular problem, that means the problem is on the inside. And if it's on the inside in the heart, don't make any plans. You probably need a new heart. Let's look at suffixes that are common. So these that we just talked about, these are combining forms. So do you think as a professor, I could easily make up a question like, oh, the word atrioventricular, which parts in the atrioventricular is the combining form? And you're going to pick the one that says atri/o, because combining form has what? Has both the root plus a vowel. But if I looked at this word, thrombolysis, right, or thrombolysis, if you want to be fancy schmancy about it, I could ask you, what is the root? Root only. And your answer would be, and I'm going to cover this O here, thromb, T-H-R-O-M-B, because I only want the root. But if I want the combining form, it would be thrombo. If I only want the vowel, combining vowel, you will tell me it is O. And the suffix, of course, lysis. So that's how you treat each and every one of the words that we go over. You ask yourself, do I know all the parts of this word? Check. Do I know what each parts of the word mean? Check. Do I know what the whole word altogether means? Check. So if you can do all of that for each one of these words, your midterm you should be able to ace, and ace it so. Let's look at these suffixes. Tachycardia. Let's break that one down. Tachy, cardia. Now, of course, ia is the suffix, tachy, prefix, card, right? Or cardi is the root. So I could ask you, what's the suffix? And you'll tell me, ia, of course. What's the prefix? And you'll tell me, tachy, of course. What's the root? Of course, we already learned it, cardi. If I ask for the combining form, you will tell me cardi. Now, even though it doesn't have an O, you just what? Attach an O on it. Okay? So tachycardia, tachy, state or condition of fast heart. So state or condition of fast heart. And we're talking about the heart rate. Now, typical heart rate is anywhere from 60 to 100 beats per minute. So my patient has if we have tachycardia, it's greater than 100 beats per minute. Now, what's the exact opposite? Bradycardia. That's a state of condition of slow heart rate. Normalcardia. State of condition of normal, right? And what's normal mean? Pertaining to the rule. And what's the rule that I just mentioned? You should be 60 to 100 beats per minute. That's your normal heart rate for an adult. And again, it's different for, why did I say again? You don't need to say it again. It's different for adults versus children, but we know that for an adult, it's 60 to 100. So less than 60, it's got to be bradycardia. Greater than 100, it's got to be tachycardia. Okay? Another term that's equivalent to normocardia or normocardia is eucardia. And U means normal, right? Or this is how I remember it. It goes U, right? It's the same thing. U should be what? 60 to 100 beats per minute. So my patient's eucardic or has eucardia or normocardia. Okay? That's tachycardia, bradycardia, normocardia, eucardia. Hey, doesn't this look like a beautiful question? My patient goes, my patient's on crack cocaine. Does they have tachycardia, bradycardia, normocardia, eucardia? Is it A and C, B and D, all of the above, none of the above? So you can actually preempt me. You can actually figure out what I'm going to ask before I can ask it. Let's now look at this gram, graph, and graphy together. Why did I minimize? I still need this. Okay? So let's look at gram, graph, and graphy together. Because electrocardiography. We already talked about that last week. Also, your abbreviation, also known as ECG or EKG, if you're in the lovely city of Berlin. So, what does graph mean? So, graph, if we look at it, graph means, gram is the actual recording. So, the electrocardiogram is the actual recording, the actual printout of the electricity of my patient's heart. Electrocardiography, remember, electrocardiograph is the actual instrument, okay? And electrocardiography is the actual, and it has the Y on the end. I want you to think process. And let's add one more. The electrocardiographer is the technician who did it. So I find it funny when I was in diagnostics, someone would call and say, hey, I want to schedule an electrocardiograph. You sound silly because you want to schedule the instrument to record the machine, right? Or I want to schedule an electrocardiogram. What, the reading of the electrocardiogram? I don't understand. But if you state, I want to schedule electrocardiography for my patient, then it's it's much clearer, okay? So that's how it goes. Alrighty. So wouldn't that be a beautiful question, right? I could mix and match one of these, and it would be gram, graph, graphy, grapher, and you'd have to figure out which one's which. And could you make that on your own right now? Sure. You could figure it out. I'm giving you all my secrets, and it's also recorded. We talked about stenosis and sclerosis. Now, sclerosis, I want you to think hardening. Stenosis, I want you to think narrowing or stricture. They're both sometimes used interchangeably, but for my exams, they're not interchangeable. Stenosis means a narrowing or a stricture, okay? And sclerosis is the hardening. So when you have two things that sound alike, do you think I'm going to put them together on an exam question? You betcha, right? So I could do that. Is it stenosis, sclerosis, both, or neither? So when you have something that sounds the same or sounds really close, or you had brady and tachy for tachycardia, memorize one like your life depended on it, and the other one is simply just the other one. Last but not least, So let's go through the layers of the heart. So you have your pericardium. You also have your myocardium. You also have your endocardium. Is a suffix that means structure of. So when we look at each one, structure of and peri means surrounding the heart. Myocardium, myo means muscle, structure of the muscle of the heart. Endocardium, structure of the inside or within the heart. So if I asked you, oh, the outside of my patient has damage, the outside of my patient's heart has damage, which layer was damaged? Pericardium. If I stated the middle muscular layer of the heart was damaged, myocardium. The inner muscle or the damage is within the valvular structures within the heart, that's endocardium. And you could also use this in when you're looking at the layers of the uterus as well. So it's peri, myo, endo, and 9 times out of 10, myo or the muscular layer is always in the middle of something. And since we learned myo, let me just add this one. Myositis, inflammation or infection of my muscle. Can I have pericarditis? Sure. Can I have endocarditis? Yep. So you could see how knowing and learning the parts and how they mean, it's like Lego. You mix and match them, and then you create new words. Here's a beautiful picture if ever you're in my anatomy and physiology class. Here's another beautiful picture. Atrium, ventricles, atrium, ventricle, right? And these are the valves. And I don't want to get into an anatomy and physiology. Now, you could use your textbook here, to answer these questions. But again, you have a lot of this stuff already in medical language laboratory. And the authors of the textbook are the same authors of your medical language laboratory. So you look at this word, arrhythmia. Let's look at that word. My patient is having an arrhythmia. A-R, rhythm, ia. We already know ia is a suffix as a state of condition of an AR or A means no or deficient rhythm. Your heart should be beating lub-dub, lub-dub, lub-dub. When it starts skipping all over the place, or even if it's too fast or too slow, that's an arrhythmia. Now, if it's really abnormal, or a similar word would be dysrhythmia. Okay? You can see how you can easily mix and match words. Oh, you look at this word bacterium. That just caught my eye. These are singular. These words down here are plural. That's why we never use the word bacterium, because I really wouldn't care less about one measly bacterium, one lonely bacterium. But when it's 1 times 10 to the 7th power of bacteria, plural, then that's a problem. Your endocardium is only a single thing. Your septum is a single thing. If your cardiac septum is the piece of the heart that separates your left from your right. But if I want to make it plural, I just take the out and add a. So septa, multiple divisions. Cardia is multiple structures of the heart. Tachy, brady, we went over. Yada, yada, yada. Wash, rinse, repeat. Let's see if there's any words. Veins. Oh, hemat. Let's look at the word hemat. Hemat means blood. Another subsection of internal medicine, and also sometimes they consider it another subsection of laboratory medicine, is the Department of Hematology. So they do what? Logi, suffix means study of, and blood. Now do not get it confused with hepat, which is liver, versus hepatology, study of the liver, right? Specific study of the liver, or hepatitis. So now you know how dangerous hepatitis is. Your liver, you'll learn in your anatomy physiology class, or those who have already taken it, has 7 vital metabolic functions. So I get hepatitis, remember, functionalacea, right? What will happen? I will have a deficiency of those metabolic functions. So let's look at the word metabolism. Meta, bol, ism. Ism is the suffix that means process of. Meta means change. Bol means growth. So that's why we eat. We have to change the food that we eat into oxygen and glucose, the 6-carbon sugar. And then it changes it again to adenosine triphosphate, and that's what actually powers you. So if you're no longer breathing, lack of oxygen. If you're no longer eating, right, lack of glucose intake, your body won't break things down. And if you're an alcoholic, what are you going to have? You're going to have a whole bunch of growth problems. You're going to have actually, if you have cirrhosis of the liver or hardening of the liver, you will also, or hepatosclerosis, which is a fancy name for it. You will also have trouble processing food, processing all these things. And actually, many alcoholics have malnutrition syndromes because of it. Because when you're alcoholic, you're worried about what? Drinking. Worried about eating is not too far on the list. Let's see. Oh, here's the varicose veins I was showing you. And those are those deficient valves. The valves then promote backflow. And then if it backflows, it starts pooling and it starts to hurt. That's no fun. That's heart valves. Atrial, you need to know that yet? AV, not yet. Oh, let's look at this. This is your EKG waves, electrocardiogram. And you could see here, this is the wiring of your heart. And a little preview of your anatomy physiology. Your heart is a muscle and requires electricity. So your brain sends these electrical impulses to your heart, and you can see how organized they are. You have your atrial here, and your QRS complex here for your ventricles. And then you have a reset, which is your T wave. And it goes very, very organized. But what happens if I have a dysrhythmia or an arrhythmia, right? You could see it on the EKG printout. And the EKG printout is called your electrocardiograph. Gram, sorry. Even I messed that up. Okay, so let's see what other words. Oh, here, if you see fatty plaque, right? And you could see once this fatty plaque starts building and becomes sclerotic, and you'll have an area of ischemia or blockage, and that's a myocardial infarction. This is your left side of your heart. This is your left ventricle. This is your left anterior descending artery, and most common place for an MI. And you could have a nice partial occlusion, would be at the level of your pericardium, which is nice. But if you have a total occlusion, it could go as deep as your endocardium, all the way deep, deep. Don't make any plans. You're not going home that day. And you're going to need a new heart if the infarction or the blockage is all the way at the level of the endocardium. And we know where the endocardium is because we just learned that. It is within the heart. It's on the inside. Plaques, yada, yada, yada. Oh, this is how you get a CVA, or a cerebrovascular accident. You could have atherosclerosis, right? You have the fatty plaques. And if you have a fatty plaque in your artery in your pinky, no big deal. But what happens if I have a fatty plaque in here, the anterior portion of my triangle where my carotid arteries are, or here, there's this circle that goes around here that's called the circle of Willis. If I block any of that, you will have something that is called a stroke. And let me write that down. So we learned last week, MI. MI is a myocardial infarction, also known as a heart attack. CVA is known as a cerebrovascular accident. So AR pertaining to your cerebrum, your brain, and the vasculature. So pertaining to the brain vasculature. So there was an accident. There was some sort of blockage. Sometimes laypersons call it a brain attack. Both situations are similar. It's when there's a blockage or sometimes a clot or damage, and it blocks that area. If that area is blocked, you don't have oxygen to the area, and that part of that brain in the CVA or your heart will die. And that is not a good scenario. Okay? That's why we give my patient anticoagulants. Anti is against, coagulation is clotting, also known as a thrombolytic, because I don't want thrombosis. I do not want an abnormal condition of blood clots. Remember, your body, everything has to be in the middle. So if you don't have enough thrombocytes or platelets, you're going to bleed to death. If you have too many platelets or the clotting factors are too strong, you're going to clot to death. So either way is not a good place to be. Genesis is a suffix that just means formation of. So we already learned the word hemat for blood. So hematogenesis means the creation of more blood. Thrombogenesis, creation of more blood clots. And also those of you religious types, you know the first book or the creation is of course Genesis. Lysis we already talked about, thrombolytic, thrombolysis. Let me also show you this other word that has lysis in it. Let's look at the word analysis. Analysis means break down into parts. And that's what you do in my anatomy class. Tomi, remember the Y, process of cutting. And what's ana? Into parts. Okay. Let's look at the word dialysis. Dialysis, breakdown. And dia in your textbook, I'm using the interpretation of dia in an old version of your textbook, and that interpretation means complete or thorough. And that's what dialysis machine is doing for you. It's breaking down your blood completely or thoroughly. Okay, and since I'm here, let's talk about diagnosis. State or condition of complete or thorough knowledge. Okay, so cis is the suffix, dia is the prefix, no is the root. And when we look at it, we start with the suffix and then go to the front and then all move our way back. And it's the state or condition of complete or thorough knowledge. That's why I cannot talk to my patient until I have all the lab tests, until I've spoken to every nurse, every orderly, every technician, and every physician that, that the patient's spoken to. Then I could tell you a diagnosis, right? And this other word, prognosis, pro means before. So state or condition of before knowledge. So that's a prediction. That's why I can't stand when people say, because no doctor in their right mind told you, oh, you'll never walk again, or this will definitely happen. No, odds are, like for example, you get breast cancer and you're a breast cancer survivor, there's a 60% chance that you're gonna get it again and in the other breast, right? So yeah, you celebrate to an extent, but you stay diligent. And why? Because we looked at hundreds of thousands and millions of breast cancer survivors and patients. So we have a little bit knowledge in our crystal ball, okay? So, and that's why I find it laughable when people say, well, the doctor said I'd never walk again. No, no one ever said that. Unless you have transection of the spine. I cut your spine, no, you're never walking again. You cannot glue back together a nerve. It's so when you go blind, right? Like let's say something permanent like retinal detachment. Your retina is a nerve. That thing detaches from your eyeball or your eye socket. You're done. You're never going to be able to see out of that eye ever again. It's just how it is. Lymphatic system. That's your immune system. Oh, here is an example of an aneurysm. Aneurysm, because of a genetic problem, you're predisposed to it, where you have a weakness in a certain part of your arterial wall. It outpockets, and this outpocketing gets really thin and it bursts. And of course, my aunt died of it. Guess what? Her mother died of. Her mother died of a CVA, which then turned into a bleed. So on that side of my family, there is a distinct risk for CVAs, heart attacks, and that thing. So I have now some prognosis. I have some before knowledge about how I should live my life, right? So because I know that there is a family disposition for it. So let's look at some of these combining forms that deal with the lymphatic system, which is part of your immune system. So adeno means gland. So an adenopathy is any disease process, remember the Y process, where? Within a gland. And if you have lymphadenopathies, that's when, you know, when you're sick, you feel the little bumps in your neck. You have lymph nodes all over the place. And lymphadenopathies signal that there is some issue in your body where your immune system is fighting something. So we use adenopathies and lymphadenopathies as signs of areas of infection. And that's why the doctor or the physician has to go touch you in all your tickly areas, because in your lower abdomen and in your thighs and all that, there are lymph nodes. And I have to see if they're active and if they're swollen. And they feel just like your, uh-oh, I'm feeling my neck right now. Well, I had a toothache the other day, so there's probably residual infection. I have a little lymph node, cervical lymph node left. Oh boy, got to look out for that. So now blood clots. When things clot, they clump up, and it's a really neat way on how to trap pathogens or things that are that can cause disease. So let's look at that word, pathogen. Patho means disease. We already know that. Gen is short for genesis. So it means creation of disease. Okay, so That's what we're concerned about, when we wear the mask and all that jazz. We're worried about our PPE is to decrease our exposure to pathogens, okay? Immunogen is something that will promote your immune system. So going outside, staying positive, you will learn how your immune system is bolstered by your mood. So if you're in a stressed out, crappy mood, the odds of you getting sick get increased. Lymphopoiesis. Poiesis means formation. We also learned hemat. So hematopoiesis is the formation of new blood. Lymphopoiesis is the formation of new lymph vessels or lymphocytes or lymph tissue. You should have lymphopoiesis when you're exposed to some sort of infection, so your body kind of like strengthens your immune system. Lymphadenitis, inflammation or infection of my lymph glands or lymph nodes. Lymphangioma. Oma means tumor. Now remember last week's lecture, I talked about itis. Tumor to us, to medical professionals, just means lump or bump. It doesn't mean cancer. Now, when does it mean cancer? Well, if I have something called a carcinoma. Oma means tumor, and carcin means cancerous. It could be benign, coming from the Latin bene, or in Espanol, bueno, right? So benign, that's the quote unquote good cancer. Benign cancer still can kill you, right? But the odds of it killing you are far, far less than a malignant cancer. And something that's mal, right? If someone is a malcontent, that's a bad person, right? Or they're in a bad mood. Or again, in Espanol, mal means bad, right? So only time that you have cancer, and the cancer is capital C, capital A, short for carcinoma, and it's post-biopsy, okay? You might have to have a test. Opsy, Y means process of viewing. Bio is life, or life itself. So I take an actual piece of you, piece of your life. I take that biopsy, I bring it up to the Department of Pathology, and the experts, logi, study of pathodisease, they look in their microscope and they see, if they see carcinoma, guess what you have? You got cancer. And then we bring you to the lovely Department of Oncology, logi, study of tumors. So they do management, while pathology does the diagnosis, okay? And of course, the oncologist, if it's a really creepy thing, they could bring them into, something that's rare, something that's interesting. They bring it down to pathology and they look at it as well, okay? So when your patient, they have a lump or bump, okay? Don't call it a tumor, don't call it a mass. Just say, hey, it's a lump or bump. We're gonna go check it out. Is it cancer? I don't know yet. Let's go check it out. My mom died of cancer. Okay. Her grandma died of cancer. Okay, there's a predisposition, but we won't know until when? My patient undergoes the biopsy. And who does the biopsy? The Department of Pathology. The creepy people in the basement, as I like to call them. They do the autopsies. Opsy means, we already know, process of viewing. But instead of bio, auto means self. Or in the case of the pathologist, the pathologist themselves wants to view the body. And typically we do autopsies if we're not quite sure the cause of death, or if it's medical legal. And if it's a medico legal case, that means the case is not only medically viable or medically important, that means there might be some criminality involved or foul play. Lymphadenopathy, lymphangioma, lymphangiitis, those are lymph vessels, the tubing. Phagocyte, phagocyte, potato. But what does phage means? Eating. So Phagocytosis or phagocyte is a cell that eats. It is actually a immune cell. It's this big thug of immune cell that's not so smart. It's kind of like a bouncer, and it rolls around and it waits for antigen presenting cells to go tell the phagocyte, and goes, hey, this guy doesn't belong in my club or in my body, get rid of it. And the phagocyte goes there and then surrounds it and eats the pathogen or the potential pathogen. Spleen is this is a little organ in your left lower quadrant, and you could have splenomegaly, especially if you have sickle cell disease, because your spleen does two things. It stores about 60 cc's worth of blood for emergency purposes, and it also deals with all your red blood cells. Red blood cells only have a shelf life about 120 days or so. So when they start getting old, they get filtered out by your spleen. But if you have sickle cell anemia, it's going to make some of your red blood cells all funny shaped, and it ruins your spleen, and your spleen gets highly inflamed and then causes splenomegaly. But remember, you can have megaly anything. You can have gastromegaly, pulmomegaly, cardiomegaly, also any organ that grows too fast or too big is called megaly. A different kind of megaly that you might also hear is this term, acromegaly. That's for people who have pituitary tumors. Now, acromegaly means a process of abnormal growth of your extremities, your hands and feet. So their hands and feet get really, really big, and they don't get stronger, and then but it's abnormal, and it causes a lot of pain with these people, these patients. Thymoma. Oma again means tumor. We don't know if it's a cancer. We don't know if it's thyroid cancer yet or thymus cancer yet. Your thymus is this organ that's in your neck, near your right next to your thyroid, and its function is to create immune cells. And you'll learn them. They're called your T cells. Right? Remember when we talked about HIV? Here's all your lymph vessels in green, and you could see the lymph nodes, and you could see they're all over your body. That's why if you have ladies and also gentlemen, you should also do your monthly breast self-examination, or BSE. When you are doing your breast self-examination, it's not only good to do your breast self-examination in the upright position, but also lying down. And also you should be hitting up these axillary arteries, these axillary lymph nodes, the lymph nodes that are in your armpit. Because if you have a cancer or a tumor, whether benign or malignant, anywhere here in your breast, these lymph nodes here will light up. And light up meaning you'll feel a little lump or bump. Even though you can't feel the lump or bump of the breast cancer, you can definitely feel it in here. This is also the reason why I'm also always tickling your stomach or reaching down here in your inguinal area. It's not because I want a lawsuit. It's because I need, like, especially if I'm expecting a UTI or maybe gastritis or maybe enteritis here, these lymph nodes here will be activated and they'll be swollen. And that's the reason why I do, well, in theory, you're supposed to do a head-to-toe assessment. But nowadays, we don't do all of that because everyone just wants to get paid. Go fast, fast, fast. But that's a topic for another lecture if you're in my clinical classes. Ooh, this is lymphedema. Edema is a generalized swelling. It's when there's too much, remember I said about your lymphatic system, it's supposed to circulate out all the extra fluid. It also has to deal with your immune system. But if you have lymphedema, your lymph vessels aren't good at circulating the fluid out of the area, and then it starts backing up like this. You also get edema if you stand around too long. In medical school, we used to have this thing called edema rounds. They wake you up at like 1 o'clock in the morning, and then you are on your feet being asked questions for until maybe 7 a.m., 6:30, and then you'll notice your feet and your calves will start swelling up. It's just vicious. But hey, that's medical school. So if any of you ever want to go, you know, good luck to you. It's not going to be fun. But if you want the greatest academic challenge of your life, go for it. Now, here on this page, look at your abbreviations, because even though the Joint Commission on the Accreditation of Hospital Organizations, they kind of frown on the use of these. And nowadays, your electronic medical records, or EMR, will actually, like, if you start typing in, like, if you type in ACE, your electronic medical records will then convert that to the whole word, or have the whole word in parentheses. So there'll be some questions on this, but you really need to know this for clinical reasons, because many times at the hospital, this gets replaced as like slang. And you can see some of the ones that we talked about here, like MI. Some of them aren't as popular, but these are quite, you know, common. The ones that they have listed here. Okay. Now, all this other stuff here is pathology stuff, so don't really look at it unless I mentioned it, like myocardial infarction, like the CVA. But everything else, you know, nice to look at, nice, but won't be fodder for any of your future exams. Okay. What did I want to show you? Now, at week 5, well, I'm going to go over this first. At week 5, we're going to start moving away from looking at word by word by word by word, and we're going to start adding on how to read and look at cases. And this is the first chapter that you have cases, and the cases are located all the way in the back, and I'm going to show you that momentarily. But I saw this pharmacology, logi, study of drugs, pharmaco. So pharmacotherapeutics is what? My management on medication. So we already talked about anticoagulants, also known as thrombolytics. They both do the same thing. So against clotting or breakdown of the clots. Well, actually don't do the same thing. This one prevents clotting, and this one breaks down the clots that you currently have. Antiarrhythmic medication is medication that will treat arrhythmias or dysrhythmias so that your heart will go back to, you know, the nice rhythm, lub-dub, lub-dub, lub-dub. But here, the funny thing about antiarrhythmic medication, if you don't titrate it or measure it up right, it'll cause dysrhythmias. Yeah. Same thing with other medications like antihypertensive medication. You give too much antihypertensive medication, what's going to happen to my patient? They will be hypotensive. So let's look at that word. Hyper is the prefix that means too much. So tension is my blood pressure. You know, I'm tensed out, my blood pressure, so that's increased blood pressure. Hypotension is also equally not good. It's decreased blood pressure. I need to be normotensive or eutensive. Normal. And what's normal for a typical 70-kilogram male? It's 120 over 80. And the 120 is the systolic blood pressure over the diastolic blood pressure. Okay. A little preview of your clinical classes and little distinguish of hyper versus hypo. So beta blockers and nice diuretic. Now what's a diuretic? What's diuresis? Diuresis, just like enuresis, it's urination. So voiding, enuresis, right? So what's a diuretic? Diuretic is also known as a water pill. This medication tricks your kidney into thinking that we're giving it the signal to throw away a whole bunch of salt. So when you throw away a whole bunch of salt, wherever salt goes, water tends to follow, and you'll learn why exactly in the physiology section of your anatomy and physiology class. But just know that a diuretic, it messes with your salt, and it tricks your kidneys into throwing the salt out or not reabsorbing it back in, so it makes you pee. And it makes you pee like every 15 to 20 minutes. It's a rough medication to have. Antiviral, okay? That's what we're all looking for nowadays. We're looking for a medication that's antiviral or against viruses. Now, we have antiviral medications for HIV and AIDS, but it doesn't really kill the viruses. It makes them inert, meaning to say is they can't reproduce and cause even more damage. And then it keeps the viral load or how much virus you have in your body to a minimum. Which, by the way, you guys heard that Pfizer has a vaccine already, and they're waiting for approval. Don't you find it funny that they're making it in Belgium? Something's funny about that. But you know me, I'm in conspiracy theory mode, so something to think about. Immunosuppressant. What am I doing with my immune system if I want to prevent transplant rejection? When you do a transplant, we can transplant anything. I could cut your brain out and put it in somebody else's brain. But here's the problem, right? Well, maybe not brain, but like your heart or your lungs, right? Because remember what I said, when you cut a nerve, you can't glue it back together again. But other things, you can cut it and glue it back together again. But the problem is, you know that saying that when you were born, whoever created you broke the mold? It's kind of true, because every person has a unique immune system. So if I put, let's say, I put your heart in my chest, my body will reject it, and my body's immune system will attack that new heart, even though I need it. And that's why we have to give immunosuppressants for our patients who have transplant in order to prevent rejection. Now, if you look at this word, autoimmune disease is your immune system is attacking yourself. Auto means self. So that's not a good thing. That means your immune system thinks you're the enemy. So there's a whole bunch of friendly fire going on and multi-systemic problems because your immune system is confused and thinks that you're the enemy. And that's just bad news. So what I was mentioning earlier, we're going to be talking about this like in week 4, week 5, but you can start looking at it now. If you look at the end of your chapters that have specific chapters like cardiovascular that specifically talk about specific organ systems, they have at the end these cases. And this is what we'll actually be doing week 5 onward. We're now in week 2. First, we got to build up some words, but you could see how the author is attempting to show you a piece of the chart. And this is what we're really after, on how to read the chart and how to interpret the chart. So we'll be coming back to this chapter in week 5. And the cool thing that your author did was they put all the nice words that are important here, right underneath it. And then it gives you some questions. Don't you think for your final exam, I could easily take these, modify these questions here, or ask about these words that pertain to this case? Yep. Hey, what does that look like? It looks like your NCLEX. Your NCLEX is a clinically based multiple choice examination. They give you a clinical vignette or a clinical story like this, and then there's a whole bunch of questions that ask you to apply your knowledge to the case, right? So those of you who have more clinical experience, you're going to find the NCLEX more palatable or easier to understand. And every chapter has 2 cases. So here's one and here's the other. But again, we'll be going back to be going back to this in week 4, week 5. All right. With that being said, that is the end of this tour. I am now going to